We welcome you to the session 2.3 Equity Focus and Gender Responsive Evaluation in Sexual Reproductive Health Intervention. At the ReproSex International Conference, Sexual Reproductive Health, which is organized by the Family Planning Association, together with STEAM organization and professionals. Before starting these sessions, let me introduce our moderator, Dr. Apita Das, who is the Senior Technical Advisor, Learning and Impact, IPPF South Asia Region Office. I welcome Dr. Apita to lead this session and start by introducing prominent speakers. Thank you very much, and we welcome you.
Much Nimal for introducing me. Hi everyone, welcome to this session. So this session is all about, you can see that about that equity focused and gender responsive evaluation in SRH domain. So why this session is important? Because, apart from that very traditional evaluation, we need to focus that equity and the gender part. Because, if we are only, focusing on that traditional evaluation, we may miss out that different strata, different people from that marginalized group, underserved, excluded people. So now this is the time to focus on that equity part and that gender responsive part. So with this, background, I would like to highlight one or two points that, if we say about that evaluation, we know that we are talking about that collection of data, research. So it involves that collecting data that is very much disaggregated data. And we need to recognize that, different needs and experience of different people from different background, different gender diverse groups, etc. So that, we always miss this gender part and the equity part in that traditional evaluation. Now this is the time. With this background, I would like to introduce our distinguished speakers who will be focusing and unpacking this, gender focused and equity focused evaluations today. So with this, I'm, glad to, introduce Dr. Asaila Kalugampithia. He is a lawyer, holds Masters in Evaluation and a PhD in Evaluation from Germany. He is the Director for Center for Evaluation, University of Sri Jayewardenepura, and he is a visiting lecturer of the Masters of Evaluation, University of Saarland, that is in Germany, and a visiting lecturer for monitoring and evaluation courses at the University of Sri Jayewardenepura in Sri Lanka. Dr. Asaila is the immediate past president of Asia Pacific Evaluation Association and has been working in the monitoring and evaluation field over more than 2 decades, including for, United Nations as a monitoring and evaluation specialist. His main expertise area is national evaluation capacity and development. Welcome, Dr. Asaila, and if you can, come to the dais. Thank you so much. Yeah. Now I'm glad to introduce Dr. Soma De Silva. She is a former UNICEF South Asia Regional Advisor on Monitoring and Evaluation, a South Asia region-wide initiative on teaching evaluation, which is she introduced and led that, establishment of postgraduate diploma course on monitoring and evaluation at Sri Jayewardenepura University in Sri Lanka. Having initiated the establishment of Sri Lankan Evaluation Association, and she served twice of its president there. She has also served the president of International Organization for Collaboration in Evaluation. Currently, she teaches evaluation at the Jayewardenepura University in Sri Lanka for that evaluation. And currently, her efforts to professionalize evaluation in these things. As a part of this effort, she has authored the workbook Theory of Change for Development Success, published by SLAVA. So yeah, I am glad to welcome Dr. Soma into the dais. Yeah, thank you so much. And the last but not the least, Dr. Muhammad Munas. Dr. Munas is a senior researcher at the Center for Poverty Analysis with a PhD in Human Geography from the Radboud University, Netherlands. He has over 20 years of experience in research, policy analysis, and monitoring evaluation. His expertise spans a wide range of areas including poverty assessment, conflict analysis, post-war recovery and development, livelihoods, small-scale fisheries, value chain analysis, small and medium enterprises, labor migration, and diasporas. Munas has led independent evaluation of numerous development interventions in Sri Lanka and teaches qualitative methods for evaluation. Welcome Dr. Munas into the dais. Thank you so much. Yes. So, without wasting time now, I would like to, invite Dr. Soma for her presentation for this session.
Thank you so much for being here. Okay, so what we are going to discuss today is about making informed decisions in SRH interventions through EFGRE. Anyone wants to say what is EFGRE? You want to guess? It is equity focused, then gender responsive evaluations. Okay, so these evaluations are very powerful things. Do you know anything more powerful than evaluation? Can you name one? I have a small gift for you. Okay, no, there is nothing. Evaluation is actually knowledge, and knowledge is power. Evaluative power is very, very strong knowledge. So why are we talking about equity-focused, gender-responsive evaluations? Because they can make the SRH interventions work, and they can make SRH interventions achieve results. Now, this word results is critically important. So let's have a small question. Can you think of a result you achieved in a program that you do? I'm sure you have a lot of experience doing programs. Do you like to share one result that you achieved or you contributed to achieve? There are no right or wrong answers. Just let's get going. Any change, that's a hint. A result is a change. Yes. So, yeah.
That you have done comprehensive sexuality education. That's been launched. Ministry of Education Skills Development has launched the comprehensive sexuality education, and that was, I think, following all the evaluations that was done, because a lot of teenage pregnancies and adolescent sexual reproductive health issues that we have. And then the second one is from Bhutan, and the LGBTQ needs assessment that we did. Now we have programs coming up, so that's the result.
Thank you so much for sharing what you did. Yes. But let's take a deeper look at what is meant by a result. And I would like you to keep thinking about it. Results are changes in the first place. Changes in people's lives. This is the fundamental basis for anything we do, any program. If we don't understand this, we can't do any development intervention, right? So changes in people's lives, but that's a rather meaningless statement. We can say changes in people's level of well-being. That's also fairly complicated. But we can say in the level of rights they enjoy. People have a right to sexual and reproductive health services. So if that access level is enhanced by a program, then that program has achieved a change, achieved a result for people. So that is the basis for everything we do, to achieve results for people. We don't need a government. That government cannot achieve results for people. That government cannot raise the level of realization of the rights of people. So having understood that to some extent, the question is, can these so-called equity-focused and gender-responsive evaluations inform decision-making in sexual and reproductive health interventions? Shall we stop for a moment? What is an intervention? Just say something. What do you think is an intervention? Anybody, please? Yes, please. Very good. Thank you.
It might be the introduction of cyanopress into facilities, so self-injection.
Yeah. Good. That is an example of an intervention. So an intervention can be anything from, let's say, an activity like that to a project, or a complex combination of projects which we call a program. It can be a policy, it can be a law, it can be anything that's going to affect the lives of, right. So we need to remember these things because this is what we are going to talk about. If there is going to be a policy, that policy must bring about positive changes for people. There's going to be a law, it's the same thing. Similarly, projects, programs, etc. So we are starting with the question, can evaluations make SRH interventions better? Meaning, achieve results for people better. What's your answer? Yes, no, yes, wow. So already we are converted, right? I'm not going to ask you how right now. Okay, so this is something that I feel rather happy about, kind of a little bit of new thinking into this field, right? There is international agreement right across the world, agreed by the governments, the scientists, the programmers, the development partners, etc. And it's through OECD DEC, Organization for Economic Cooperation and Development. And what they say is that any intervention to be successful must have 6 criteria. Is that okay? Must have 6 criteria. Even for you to live your family life. Is that a project or a program or a policy? It's all really. Yeah. Even for that you need these things, right? So, but to explain these and understand them, it takes a minimum of 5 days for intelligent, right? Out of those 2 criteria, we have 1. We have intelligent people, but we don't have 5 days. Therefore, we have to run through this quickly. Interventions have to be relevant, meaning people must want them, need them. That intervention must fill a gap that exists, right? And let's say an SRH intervention, let's say education about sexual and reproductive health. If you educate, let's say, okay, you distribute sanitary pads to men in a project. Is that relevant? But we do similar things. We do similar things. Okay, so relevance. Similarly, effective. Meaning what we do must contribute to bringing results. Efficient must happen at reasonable costs, basically. There's no point in achieving something little at a very high cost. Should be optimal cost and sustainable coherence. This is recently added, meaning people try to do the same thing, particularly in times of disaster, etc., or even in normal times. For example, a very simple, common example is so-called awareness raising programs. So 10 agencies do the same awareness raising, and it's a duplicate, it's a waste of resources as well. And then finally, that impact, the change in the level of realization of rights, change in the level of knowledge, change in let's say, reproductive behavior, in accessing services, whatever it is, those 6 characteristics must be there for a program. So what I am saying here is that when you are designing an SRH intervention, or if you are even working for an SRH intervention, take time to see whether these criteria are met. Otherwise, however hard you may work, it's not going to work. That's the current state of knowledge in the world. Do you agree? Has a program got to be relevant? Has it got to be effective? A commonest example where interventions are not effective is the so-called training, right? So, okay. So, gender responsive. These are laden words. Gender responsive and equity focused. Why not gender focused? Why don't we say gender focused and equity responsive? Shall we change it? Okay. Think about the work you do, your workplace. Can you think of something that is done in a gender responsive manner? Surely one example.
We have women, we have persons with disability, we have LGBTQ, so we have genders like different who needs different needs. So we become very responsive to the need of that particular person that we are, a person-centered kind of a thing. And equity is, of course, the need particular person at that particular time.
Yes, that's a good example. So what you meant was something like this. If you just take men and women for right now, we know that gender is more than that, but a program has to be designed in such a way that we understand that men and women have different needs. For example, the way they might want to be trained can be different for women than for men. A very simple example, the times could be different. Women, mothers may want to have the training, let's say in the evenings, and men may want it during lunchtime or something. So understanding those needs and responding to them, meaning and providing the intervention in a way that meets these needs. However, this is much more than that. We need to understand that. But that word responding means responding to people's needs, that they are different in different groups. But equity, anyone can give an example for equity from your workplace, from your life. Do you try to promote equity? Have you tried to do that in personal life or outside at work? What is equity? Since you smile, can you?
Well, I can give you an example, not from my personal life. Basically, I feel maternity leave is an example for equity.
You're not rich, right? So, thank you for raising that. All this time, the fathers just escaped, isn't it? So, equity. Recently I saw in a newspaper that the government is going to get a grant or loan or something, and they are going to raise the standards of medicine, engineering, and science faculties. And I felt so very angry and sad. What are they doing here? What are they doing? You don't feel angry. One thing. Yeah, very good. And the other is the so-called humanities, social sciences, arts, etc. are already so disadvantaged. I mean, they might as well not exist. Now, by raising the standards of these, fine, something is good. But what are they doing? They are increasing the gulf between the disadvantaged and the already advantaged. So that's why it's so important to think about these things. And in programming, if you're participating in a program, be brave, be courageous, have courage, look for these. A gender responsive program, the only difference here is when we say gender, we look at gender categories. Equity means we look at all affiliations, social affiliation groups. Time? 5 minutes, okay. So we look at needs, rights, preferences, power relations. These are things that we need to look at in designing programs. And equity focused also means more or less the same thing, right? But you understand the differences. Gender particularly refers to gender categories, but equity is also there, okay? Now you can see inequalities existing side by side. In these kinds of situations, there can be interventions which broaden the gap even more, which widen the gap even more. So now these gender responsive and equity focused evaluations, how do they make SRH interventions better? This is what they do. They identify disparities. They have lenses to look for disparities, identify them. But if you identify disparities, is that enough? Is that enough to take action? Evaluation tells you there is a difference between men and women. So what? You need to know the reason. Always the reasons must be known. Why question must be inquired into. So these evaluations identify the disparities and the reasons. If an evaluation report does not give you the reasons, what should you do? What will you do? If you have commissioned an evaluation, you get a report saying there are huge disparities between this and that and the other. That's it. And what would you do? Yes, you throw the report at his face. because that's not an evaluation. You need to understand why. And this is the reason why that evaluations are now moving more and more from quantitative, not moving away, but supplementing quantitative with qualitative to understand the lived experience. The experience of an abused woman cannot be found out through a survey, a quantitative survey. You could identify them. You may need a qualitative approach to be able to understand what she's going through, okay? And with that, you get gender responsive and equity promoting policies because you know there are differences and you know why. So you can bring policies, you can make the programs more targeted and inclusive, you can optimize the resources, we can speak for hours on at each one of them, but I'm sure it's pretty kind of transparent. And with all that, the impact can be made sustainable. And finally, you can advocate for better responsiveness and equity. I'll just do the next one slide and finish off. No, I don't need that. So these types of evaluations, EFGREs, look at gender disaggregated data, meaning if it's poverty among men, poverty among women. So you disaggregate it. Now, COVID data, nowhere in the world was available for men and women. Yeah. So, and you have to look at gender-specific data. Some data are specific for different gender categories, but most important, I have given some examples here, but the most difficult thing to measure is gender power relations and system, because that has to go beyond the usual traditional. This is one example of where SRH has been used to improve, EFGRs have been used to improve SRH services. This is a UNFPA program done in Jordan and Syria. It's a humanitarian program. SRH services were provided to women and girls separately. Then the evaluation found out that doing the services separately, there was a major barrier to SRH services, and that refugee women faced further problems. Now the question here is, the evaluators can say that, but if the program managers did not listen to it, nothing would have happened. Do you think program managers listen or don't listen? How many of you say yes, they listen? How many say they don't? You know, it's like you can prepare a nice meal and serve it very attractively. But if there's no one to eat, or there are people around, they don't decide to eat, they don't want to eat. It's like that. You can do the evaluation, but there has to be a mechanism for using the evaluation. Almost mandatory. Not only to use the information, but also to see that it's fully implemented. So they did that. What they did was they revised to integrate SRH and GBV, and the result is higher service uptake and better outcomes. So I'll stop there. Right. Thank you.
Thank you, Dr. Soma, for informative presentation. Thank you so much. Can I request then all speakers to come on dais? Yeah. So much for this presentation. Now we can have a discussion on this equity-focused, gender-responsive evaluation. So can I request Dr. Asela to, if you have some reflections or inputs on that, please feel free to take your mic. Thank you so much.
Thank you very much. And also a great presentation from Dr. Soma, setting the tone for this session. Now, I just want to mention a few examples how we can use gender responsive evaluation, equity focus and gender responsive evaluation for SRH programs. Now, in this conference, there has been a lot of discussion about abortions, use of condoms or SRH services. Now, let's take use of condoms, right? It's easy for us to say, okay, we promote condoms and how it is useful, and also the access to condom is ensured, right? But now, how do we know actually people use condoms and what are the barriers, right? And also, I know that especially among sex workers or even other women, condoms are promoted, and they take condoms, but whether they are able to ask the man to use a condom, what are the barriers women have to ask the man to use a condom, right? Now there may be several reasons for that, factors for that, and now this is where we can also see how equity focus and gender responsive evaluation comes in. If we do an evaluation and see the social groups or the education level or the income levels of men and women, and Dr. Soma mentioned about disaggregated data. This is where we need disaggregated data, not only between women and men, but also social class, different religions or other factors, and see what are the groups, especially women, are able to ask a man to use a condom, right, when they have sex, or what are the income levels that women are able to ask the man to use a condom. Now, these are some examples. And when it comes to youth, we usually say that youth have, access to SRH services, right? That is one of the results we expect. But at the same time, we know that some youth have the advantage to have access to SRH services, but some youth don't, right? But have we, taken or considered disaggregated data and see, okay, which youth groups have access to SRH services and which groups do not have access to SRH services, and what are the characteristics of this youth group? That is very important. This is where we can, through the evaluations, if we find out this information, this is where we can have our effective strategies to improve the services, right? And we know that now some of the indicators we use for monitoring and evaluation, let's take again condom use. Number of condoms distributed, how effective that indicator is, right? If we have distributed 100,000 condoms and only 10,000 use, 90,000 not use, right? Because that's where the quality, again, Dr. Soma mentioned about qualitative data and qualitative data collection. That's where the qualitative data is more important, right? The use is more important, right? So monitoring and evaluation, especially evaluations with disaggregated data, not only the gender, but other factors are very important. So you can have effective strategies, plan for effective strategies, and implement effective programs, especially for the program managers, whether they listen or not. Program managers, this is very important. Let me also mention very quickly about one example I have when I was working for a program in Sri Lanka, especially tsunami affected areas. This is during just after tsunami, we had a support for women centers, especially Matara, Hambantota and Ampara, other districts, tsunami affected districts. Through these centers also there was an awareness program for men, and as usual the staff work during the day, so they planned these programs during the day. When you invite 100 men, what do you think, how many men attend this program? Yeah, less than 10. So I was the monitoring and evaluation officer from, of course, I was working for UNFPA at that time here. So we discussed this, right? And then we discussed, okay, what are the factors or, conditions for men to gather? In Matara, we discussed, okay, anyway, they gathered, after work around 6:30, 7 for different reasons, of course. And then we discussed, okay, why don't we plan these programs? This is about male participation in prevention of gender-based violence, right? So they arrange, some kind of, snacks also for the men, and in the evening, some music and these programs. When they invited 50, how many attended? At least 100. So this is how we can improve programs, right? We have to have, continuous review and information, and also see how different gender and different class of people in their context react to different needs or programs, right? So we had very successful program. First few months, the staff struggled, but after that we had very engaging program with men regarding male participation in ending violence against women. With that, let me finish. I know you are looking at me, but time.
This is very important, as you have mentioned. For the tailored approach, we should, apply, and for that we need to have, the different people's opinion, their needs, experience, so that we can have that evidence-informed intervention rather than random. So this is very important to talk about. Thank you so much. Now I will come back to you and Dr. Soma again, but before that I would like to hear from Dr. Manas. If you would like to share your reflections or inputs about that equity-focused gender, responsive evaluation. Over to you, Dr. Manas.
Thank you, Arpita. Thank you, Dr. Soma and Asela, for setting the stage for this. I think most of the things have been said, but I'd like to stress one fact here. The evaluations, we usually say, you do it after the project. So what is important, especially in programs like SRH interventions, this has to be taken into account. I mean, you do evaluation at the end, but you need to conceive it in a comprehensive manner before you even start the program. So my call is actually not to the program design people, but even it goes one step ahead, and it is for the donors. The donors need to, there needs to be serious commitment in relation to how you allocate funds, for instance. I mean, we have seen in many evaluations, in many projects, the evaluations are usually rushed, right? I mean, you are given 3 months or 2 months. I mean, maximum 3 months is given for an evaluation. Then you have to, rush the process. There's no time to, go through the documents. And there's also the primary data collection that needs to be addressed. So many things that you have to do within a few months. But these are programs that have been implemented for 4 years, 6 years, 8 years, right? I mean, your findings are slim because you can't get to the depth. So my call is to go a couple of steps ahead and, talk to the donors, and the donors need to also incorporate these requirements, because at the end you implement a program, and it's also a learning exercise. So if you don't learn from the program, then it won't be a sharper program in the future. So that's one point that I would like to raise here. And the second one, Dr. Soma already touched upon it, is looking at the context. So you need to understand in which context the programs are implemented. So the context analysis, a thorough, deep context analysis will give you what exactly the issues are. So Asela raised this issue of social, use of the program activities. You don't find it's being used because you have not designed it. You have not designed it because you have not spent enough time analyzing the context. So you need to understand the social norms, social structures, barriers, taboos, for instance. I mean, if you are implementing SRH programs, you need to know what kind of groups you are working with, right? I mean, those groups need to be thoroughly identified and what their needs are. There are different, if it's within the refugee community, for instance, usually the refugee communities, you call them invisible communities because they don't like to show themselves. So you need to, you need to make an extra effort to understand the context, identify who they are, what their needs are, what their interests are, and then design the program. So this is a couple of points that I would like to add to what both of them said.
Yeah, thank you so much, Dr. Munas, that you have raised so many important points. First, that you have mentioned that we need to know the context first before, design an evaluation, that, and on the basis of that, evaluation, we can, sketch our intervention in that way. Another thing that you have raised about that, the advocacy to the donor for that, for that evaluation, because we can't do in rush that evaluation things. We have to have that pause and reflect what had happened and then moving forward rather than going in a same line, it could not be done. So very important point. Thank you so much to all the speakers. Now, in the second round, I could ask, few questions that, so first I would like to ask Dr. Soma that when you have presented that, 6 criteria, I would like to know that how you will integrate that equity and the gender part into the 6 criteria of development intervention, that we can ensure that we are not going to leave anyone behind. Over to you.
Yeah, and thank you so much for for mentioning that last phrase, leaving no one behind. So the whole idea of gender responsiveness, equity focus is to make sure that our interventions don't leave anyone behind. Sometimes it's not only leaving anyone behind, sometimes it's also leaving people in a worse situation than before. That can also happen. So these 6 criteria, I personally don't think, I haven't come across literature that considers these 6 criteria explicitly at the stage of the program design. And that is really very important. You can't do evaluations and make use of the findings if the program has not been designed properly. So even before the design stage, even at the time of conceiving the concept program, those 6 criteria of relevance, effectiveness, efficiency, coherence, impactfulness, and sustainability. So far, the literature that I have seen looks at these as if the whole population is homogeneous. And evaluations also have done that. It's rarely that you see evaluations that look at these in a gender response manner, in a manner that different groups of people identified with their social affiliations are also examined. So therefore, if you look at relevance, then you have to see, is it relevant for men, women, LGBTQ, etc. And you have to look at age groups. What is good for young age groups may not be good for old age group. You have to look at caste groups or whatever is relevant, whatever is key. So we don't have, and another important thing about relevance is that it should meet the felt needs of the people. However important something is to the donor or to the program manager, it may not be, if it's not important to the people that we are going to serve, then it's not going to be, that's the idea. The other thing about relevance is that the context, as you mentioned already, context is really important. A program must suit the context, but the context keeps changing. Say, for example, COVID came. So what was relevant before is no longer relevant. If tsunami comes, or if some other thing happens, or just social change, or the government change. So keep a program relevant, then the program managers must keep an eye on the context and make the necessary arrangement. Many times I have seen in major program reviews, when the funds have not been utilized, when the results have not been achieved, common responses are, okay, UNICEF didn't provide the books in time, or it was raining, so therefore the seeds could not be planted. Don't you feel very sad then? If it wasn't raining and the rain wasn't going to come, surely your responsibility is to change. No? Now, if the donor wasn't going to bring the books in time, what would you do as program managers? No, you might know that the donor has done this before also, right? So we need to do something about it. We need to have an output that books are received by this date, and if not, deal with it, kind of thing. So there is no time to go through those 6 criteria, but I took relevance as one example. But with your permission, I'd like to say one thing more, and that is, now it is not easy to do all these things. You need qualified, competent people. Not qualified, you need competent people. Competency is the key thing. In our countries, we do not have a core group of such professional evaluators so far. And I mean, Dr. Saylor is trying very, very hard to have evaluation academic courses in the university. So we need to have a group of people, a core group, a critical mass of qualified people, academically trained and practiced under supervision who can then go to critical position and influence and make the change.
This is very important point. And when you were talking about that, that felt need, we need to understand first. So that's why nowadays we do that co-creation, co-design, so that, the target audience can be part of that, evaluation design, rather than we researcher, design and implemented in the field. So it should be that bottom up rather than other. So this is a very good point. Thank you so much for, mentioning all those points. Now, if I come to Dr. Asela again, about that one question I'd like to ask you about that, how the concept of intersectionality that can be incorporated in that gender responsive evaluation to to get to know the expectations or to address the diverse experience of different groups, so that how you are looking at that intersectionality in that gender diverse evaluation. Yes.
Okay, thank you, Arpita. Let me again bring short story before I say more about intersectionality. Now, most of the Sri Lankans know this program, distribution of Poshana Mallo, nutrition pack for the pregnant women. But it was given to all the pregnant women, right? Whether then a billionaire's wife gets nutrition pack, or the family who don't have 3 meals, everyone got the nutrition pack. But the question I had was whether the government had a strategy to give this nutrition pack to the needy people or the pregnant women who really need that. Because later on the government realized that some of the women use this nutrition pack, they just got money, and then what they did was they used that money for cents or any other scent or some other other things, not the nutrition, right? So this is that shows that some of the women do not need this, right? So whether the government had really a strategy, if they really wanted to improve the nutrition of pregnant mothers, so who are the needy pregnant mothers for this nutrition pack? Now, when it comes to intersectionality, that's how we need to see whether really the race, the religion, age, class, or maybe gender are considered for our interventions, right? Even in the evaluations, if we consider these and also have disaggregated data, we can see which class of the society or which age group of the people or which geographical area people are coming from have the advantages or disadvantages or disparities. Dr. Soma mentioned about the word disparities, right? So we need to know about disparities, then only we can see, okay, how to focus our programs based on the evaluations, the evaluation findings we get from. Now again, after the program I mentioned, tsunami program, the other country I worked in was Afghanistan, where gender disparities are very high. 5-year girl is married to a 60-year-old man, right? Why? The man pays the girl's father. If father needs money, $1,000, $2,000, you pay the father $1,000 or $2,000, then you get the girl. And that time my daughter was also 5 years, right? So that's how it is. So you see the gender issues compared to other countries in South Asia, it's very high. And it's not only race, caste, or the geographical area, but religion and customs and the traditions they have, right? Traditions may be not coming from the history, but some traditions are made up strategies, traditions for the benefit of men. This is what I understood in Afghanistan, right? Sorry if there is any Afghan here, but this is what I understood. Because if you want to dominate things, you just say, okay, this is our tradition, women should be like this, right? So those are very strong, and if it's also about the power relations, right? The other factor I think we have to consider in our evaluations are the power factor. Who has the power, right? Which social group? I think these are very important. So when it comes to intersectionality, I think we have to consider this. Thank you.
And as you have mentioned, that the need assessment that should be included, in the first phase of that evaluation or the intervention. After assessment of the needs, then we can plan or design rather than randomly, making interventions or evaluations to, reach to the unreached or reach to the last mile. So need assessment is very much required. Yeah. Thank you so much for, addressing these issues and points. Yeah. Now coming back to Dr. Manas again, as I saw that you have expertise in both quantitative and qualitative, and we in Dr. Shoma's presentation we heard about that, that both quantitative for the question is what is happening, but why this is happening, that can be answered through qualitative approach. So I would like to, ask you at what approach can be adopted to, balance between that quantitative and qualitative data in that evaluation that can give us that informed decision making, focusing on that two part, that equity and gender responsive things. Yeah, over to you.
Thank you, Arpita. I think Dr. Soma already highlighted it. The fact that we have to move we have to combine quantitative and qualitative methods in evaluation. I mean, we can't compromise on that. There are certain methods that methodologies we can adapt. For instance, developmental evaluation is something that, as a methodology, it's very interesting. And also important for something of this nature, like, SRH interventions, because in developmental evaluations, you are not an external to the project. You be part of it and you learn from the intervention. You reflect with participants, record it, and then repeat the observations. As the project progresses, you learn from it and implement. The biggest challenge in that is one thing Dr. Soma already raised: the capacities, the competencies, and the second is it's a lot of time consuming. So most of the donors wouldn't like it, because you would be spending considerable amount of money of the project learning from it. So that's an important part. DE also allows you to bring in quantitative data, right? You can use mixed methods to learn from it. You can use the project baseline data and the midline and end line and all. You can integrate easily, and it adds a lot of you can talk about stories, narratives, lived experiences, all bring together, and then it's a very comprehensive methodology. So one thing that I would like to also highlight here is that in any evaluation, especially evaluations of this nature, needs to take into the account of the ethical factor. Because this data, you are talking about marginalized, vulnerable, hidden population, and for instance, things like teenage pregnancy, right? STD. In our context, these are like taboos. You don't talk about it, right? And then you collect data, and you also need to be very careful in how you store, how you analyze, how you report back, disseminate, all these factors. Yes, DE, development evaluation, and any evaluation methods will bring, rich data, but you also need to be very careful, especially in relation to the projects that are dealing with SRH issues. So, that's a brief, addition to what you.
Yes, absolutely. Very good point, Dr. Manas. Thank you so much. I would love to hear more and learn more from you all, but due to interest of time, I can, open this floor for that question and answer session from the audience. If you would like to ask any, we can take one or two questions if you'd like to ask anything to our speakers. Anyone how you can incorporate this equity focused, gender responsive evaluation for your recent work? Yeah, she.
Thank you so much for everything that was shared to all the resource persons. I learned a lot during this short span of time. Now, since we were on the topic of intersectionality, intersectionality, we talk about powers and privileges, marginalizations, vulnerabilities, and how do they interplay. When we talk about now in this conversation, we are talking about SRH. But if I am to ask you about SRHR, including the rights, if we are talking about rights as well, how do we make, how do you go beyond focus on individual rights and ensure there's equity in terms of justice, because something that we try to promote in SRHR work is that, we want to say there must be reproductive justice, and our work, our strategic interventions must be designed in a way that will ensure that there is justice, not just affirmation of rights individually, but we look at groups. We look at marginalized groups, regional contexts, which are, sometimes similar across regions, similar challenges, but sometimes very specific and different. So, in your work, do you adopt this lens of, ensuring that there is a reproductive justice approach to your work around SRH, or, just want to know from your experience?
Yeah, thank you so much. Like to respond?
Well, whenever we talk about evaluations, we always talk about monitoring also. So whatever we talked about right now, is it what we are doing? Monitoring? That's right. Yeah, need assessment, and then the monitoring, and then the evaluation. So
Okay, we take.
Yes.
Okay, I don't know whether we work specifically reproductive justice, right? But now when it comes to, yes, rights, now in SRH, mainly we are focusing on ultimate results we expect, rights and justice, right? That's what the ultimate result, I think Dr. Soma was, trying to explain about results we try to achieve. Now, whatever we talk about, other things, maybe output level, outcome level, the use of condoms or decision making, or even abortions, things like that, how, ultimately contribute to ensuring rights of people and also SRH justice. Now, that's why our program should be focused on towards that. At the same time, program managers, program implementers should have, clear understanding about what are the results we are targeting. And that's where monitoring and evaluation is also very important. At the same time, this topic we are talking about, equity focus and gender responsive evaluations. So without knowing about different segments of the society or the groups that enjoy their rights and also have the justice, or the groups do not have their rights or justice, that we can definitely focus our programs accordingly. So there is, huge responsibility to the program managers, implementers, and decision makers, also the policy makers. Now, in this conference, we talk about a lot about advocacy regarding abortion, other things, and this morning we had very interesting panels about those topics, and those are the decision makers, right? Policy makers. How do we address them? Now, when it comes to abortions, even I hear that these days in the political rallies also, that addressing about some of the issues, abortions, and also accepting rights of different groups, accusing other groups, other political groups, right? So this is also coming to the political agenda. But how politicians or decision makers take right decisions based on and according to the human rights of people, right? And rights of people. So those are the important factors we need to address. And again, it comes to when it comes to advocacy or working with decision makers, working with policy makers, again, it comes to the program managers. I think program managers, although we talk about equity focus and gender responsive evaluation, evaluators conduct the evaluations and make findings and recommendations. Again, it comes to the program managers to plan effective programs to achieve those, ultimate goals. And ensure that people have, those rights and justice. So I think there is a bigger role for program managers and implementers. This is what I want to highlight.
No, I think Asela covered it pretty well.
I think,
Yeah, monitoring, and also to add a line to this, I really don't know I don't know about the SRH programming, but about an evaluation, any reports talking about just per se. It's not a wide practice. However, when you talk about realizing rights for all people, isn't justice implied there? So it has to be fair, it has to be equitable. But frankly, I don't think evaluators or evaluation methodologies give specific reference, I'm not sure. But programming should definitely do that. And if that's one of their targets, then evaluators can be asked, look at. Very interesting. Yes, definitely very,
Moving beyond right to just.
Exactly.
And that's the just part. Earlier we called SRA, we called SRHR, now SRHJ. So now the interventions are focusing on the J part as well as that evaluation. We will going to adapt J part to evaluate that how it goes.
Right, and this is where new methodologies have evolved. I know for SGs, the universities were required to come up with methodology. And of course, something we forgot, thank you for raising it, without monitoring, there cannot be good evaluation. So monitoring has to happen right from the beginning, and that also has to be rights. So that should happen, yeah. Thanks.
I mean, when I mentioned that it's a developmental evaluation, it's part of the monitoring as well. You start from the inception or early stage of the project.
Yeah. Thank you so much to my all speakers, Dr. Asaila, Dr. Soma, Dr. Munaz. Thank you so much to the audience that for this, great interactive session. Thank you. And with this, we can close this session. Thank you so much again.